Welcome to Evergreen Family Medicine. Today we are with Dr. John Burden. He is a hospitalist for Evergreen. Welcome.
Thank you.
First question, kind of obvious. Tell us what a hospitalist does.
Sure. So a hospitalist is a doctor who works in the hospital. I care for patients who come into the hospital who are part of Evergreen's practice and care for them there.
Is there an advantage for an Evergreen patient going into the hospital since you're there to watch over them?
Yeah, I would say so. So the continuity of care that is nice in a primary care setting where you're seeing the same physician every time you come to the doctor or the same group of physicians, that is also maintained when you have a hospitalist that's attached to an outpatient practice. Just to be able to contact that primary care doctor or the other healthcare providers that care for the patient in the outpatient setting helps me when the person comes into the hospital to care for them better. So we're not starting from ground zero when they come into the hospital.
That continuity of care, we hear that phrase a little bit when we talk about the pod setting at Evergreen, where the schedule just doesn't allow a particular provider to see every single patient every single time. And so that group effort so that the information is there. And like you say, a person coming in doesn't have to start from scratch every time. And so continuity of care in the hospital then for Evergreen patients makes sense. Feels to me like next level service from Evergreen watching out for their patients.
Different practices will try to do it in different ways. I think the way that Evergreen has it established is pretty awesome, because then it allows for myself when I'm on, and then when I'm off work, then one of the other providers will come in and focus just on the inpatient care for the people who are admitted to the hospital. That way, there's not a divided attention trying to either be in the clinic and see people in the hospital, and I think it's a better care.
Well, I know you're a recent transplant, if you will, I guess, it's a medical term, to Roseburg and Douglas County. Why don't you tell us about your background and how you came to Evergreen?
This part of the world, though, this part of America is pretty awesome. I've always loved the mountains. I've always loved the coast, and Roseburg is kind of like this perfect little valley, in the mountains, but you have bigger mountains just to the north or to the northeast, and then you have the coast to the west. It's pretty nice. So when we were looking in this area, my wife and I, as we were nearing the end of residency, we just started talking to recruiters for the Pacific Northwest and heard about this job, and very intriguing. And once we met the other providers from Evergreen when we came for our interview, we knew it was the right place for us. Very good. Yeah, we hear that a lot. The people here, the location ain't too bad. Obviously, Crater Lake this way, the coast this way. Right. If you can go hit the big city if you want to. It's not too far away. So, and a lot of outdoor activities here as well. So where are you from originally, and where were some of the stops along the way? I grew up in northwest Montana, near Glacier National Park. It was kind of a backyard, so I've always loved the mountains. Went to Montana State University, where I graduated with cell biology and neuroscience. After that, I went to Loma Linda University for medical school. I did a year of surgery residency there, and then after that did family medicine residency at Chattanooga for University of Tennessee. And then here. You've been around a little bit. You've seen some things. What are your early impressions of Evergreen? Great. It's a great place to be. I think there's a saying amongst graduates or people who move from residency to their practice, where your first job is often not the one that you're going to stay at. In fact, don't expect it. But I haven't seen that at all here. I would think that I'd be happy for a very long time here at Evergreen. There's a lot of apprehension when it comes to moving from residency, where you have a lot of supervision, and even though through your training you become more autonomous as a physician, you still have that there. It's kind of like a safety blanket. As soon as you graduate, it's gone. So when you find a place to work like Evergreen, where there's so much support between the providers, between the other healthcare workers that really functions as a team for the care of the patient, it makes it a very comfortable, a very easy place to work.
Well, we've talked about you being in the hospital, which might be a place where Evergreen patients may see you, but you also take a turn or two occasionally at Evergreen Urgent Care. Tell us about that role.
So the urgent care is a pretty amazing place. They see a lot of patients, and as far as an example of how well the team works at Evergreen in general, the urgent care is a definite example. The shifts I work there, I just see patients as they come in, and I have an opportunity to kind of see Evergreen and see the community from a different perspective than from the hospital, which I think is important when it comes to then how I see patients and approach patients in the hospital setting too. I've actually had patients who I've taken care of because just a couple of days before I've sent them to the hospital from urgent care. So that continuity care, again, kind of clicking into place. The way the organization of Evergreen works and their mantra, if you will, is that everyone who works for Evergreen should find how they, like what their passions are and what they can bring to the table, and then we should be able to use that. So being able to have multiple options, multiple different ways I can express myself in my career and my passion for a community is very well supported, and I like that.
Great. Well, welcome to Oregon. Welcome to Roseburg. Welcome to Evergreen.
Yes, it's awesome.
Thank you for your time today.
Thank you.
All right. Dr. John Burden with us today here at Evergreen Family Medicine. You can learn more about the providers and services available through Evergreen Family Medicine at evergreenfamilymedicine.com. And you can follow us on Facebook, Twitter, YouTube, and Instagram.